Welcome to Doctor to the Garbage Pail Kids, the single best way to learn medicine after an accredited medical school has turned you down. I'm Matthew Tortora, and I'm a board-certified pathologist in New Jersey. And in this series, I'm going to diagnose the aches, pains, and other ailments of the characters from that all-at-once beloved and reviled, iconic 1980s trading card series, the Garbage Pail Kids. But before I begin, a quick disclaimer that the content on my site is for educational purposes only and does not substitute professional medical consultation with your actual doctor. If you'd like some general background information on what the Garbage Pail Kids are, please feel free to check out my teaser installment listed in the link below. Otherwise, sit back and enjoy the course. Today, we're going to talk about Joel Hole. Joel is an ordinary fellow enjoying a game of golf, with a hole where his left eye should be, because he tore it out to use as a golf ball. The obvious question is why? Why did Joel Hole pull his own eye out? The technical term is autoenucleation, also known as Oedipism, after the mythological figure Oedipus, who gouged out his own eyes. It is the self-inflicted removal of the eye, and is considered a form of self-mutilation. Causes include psychosis, paranoid delusions, and drugs, particularly methamphetamine. So in all, despite his polished outward appearance and even golf swing, there's a good chance that Joel Hole is severely mentally ill or eating crystal meth. Perhaps one overlooked clue was in his tiny comma-like eyebrows, no doubt tweaked down to razor-thin nubs while high. Although you'd never guess from flipping through the Garbage Pail Kids stickers, losing an eye is a serious matter. In the vast majority of cases, enucleation, removal of the eye, is performed surgically, usually while leaving the surrounding structures, like muscles and soft tissues, in place. This is different than evisceration, which refers to removal of just the inner content of the eyeball, while leaving the outer structure of the eye in place. Lastly, there's exenteration, which is removal of the whole eye and all of the soft tissues and structures around it. There are many reasons why enucleation may be medically necessary, the most common of which is trauma, including gunshot wounds, physical violence, and penetrating injury. Other reasons include infection, pain, and lastly, tumors. Two such tumors warrant further discussion. They're called retinoblastoma and ocular melanoma. Retinoblastoma is a rare cancer that occurs in the eyes of children. Melanoma is a cancer arising from pigment-containing cells. They're the two most common primary cancers arising in the eye. You might be wondering why these specific tumors. The answer is in the anatomy of the eye. When the ophthalmologist or eye doctor looks through the pupil at the back of the eye, the retina is what he sees. Its red color is what causes the appearance of red eyes in old photographs, known to doctors as the red reflex. The retina is composed of a thin sheet of cells coating the back of the eye. These cells include specialized nerve receptors that can detect light, called rods and cones. Retinoblastoma, as the first part of the name implies, comes from the cells in the retina. The latter half of the name, blastoma, is a reference to the fact that these cells take on a primitive or immature appearance. When we say primitive, microscopically, that usually means that they have what's called a round blue appearance, which resembles the nondescript, round bluish immature cells seen during early or embryonic development. Doctors might first detect this because the tumor blocks that normal red reflex as seen here. Melanoma, on the other hand, is normally a tumor of the skin, usually caused by sun exposure. It's derived from skin cells called melanocytes, named after the brown pigment they contain, called melanin. But how does melanoma arise in the eye? The answer again is in its anatomy. Let's start with the iris. What makes the iris, the colored part of the eyes, brown as opposed to blue or green? The answer is the presence of melanin. When it's present, the iris is brown, and when it's absent, the iris is another color, such as blue. When we look at the eye again in cross-section, we can see that the iris, color-coded green in this diagram, is connected to two other structures, one in orange and one in brown, called the choroid. The choroid is a shell of tissue located behind the retina and in front of the white part of the eye. The whole complex is known as the uveal system, and the choroid, just like the iris, is loaded with melanin and the cells that produce it, melanocytes. And it's from these melanocytes that melanomas arise in the eye. Irrespective of cause, be it a tumor, trauma, or tearing out your own eye to use as a golf ball while possibly high on crystal meth, the end treatment is the same, to be fitted with an ocular prosthetic. Ocular prosthetics can be fashioned from all types of materials and have been found from the remains of humans from as long as 5,000 years ago. Although most prosthetics had historically been made of glass, today most of them in the US are made of acrylic. The advantages of acrylic over glass are numerous. Acrylic eyes provide greater comfort. They're easier to shape to the patient's eye socket and are easier to color, and they are stronger and more sanitary than glass. As we set Joel Hull up to be fitted for his acrylic ocular prosthesis and therapy for meth use, let's summarize the big points from our session. Enucleation is removal of the eye, usually due to trauma, infection, or tumor. The two most common primary tumors of the eyeball are melanoma and retinoblastoma. Replacement of the eye is typically done using an acrylic ocular prosthesis. Lastly, of the many reasons not to use crystal meth, one of them is that you might pull out your own eyeball. Thank you for joining me for this episode of Doctor to the Garbage Pail Kids. I've hoped that I've managed to teach you a little something about medicine while rekindling your nostalgia for the 1980s. If you enjoyed what you saw, feel free to like, comment, share, and subscribe to my YouTube channel.